I'm Thomas Baldrick. With me is Dr. Zeenat Safdar. She's the Director of Pulmonary Hypertension at the Baylor College of Medicine. Thank you for stopping by.
It's my pleasure.
So let's talk about the poster you presented on spironolactone in PAH patients. What can you tell us about that?
Spironolactone is a drug that we use as a diuretic in pulmonary hypertension. But there's a lot of data suggesting that renin-angiotensin-aldosterone system is activated in patients with heart failure, especially left heart failure. There's accumulating evidence that it might be activated even in right-sided heart failure, as we see in pulmonary hypertension, although there is not much data published in that regard. Anecdotally, we use spironolactone in our patients, and we feel that in patients with PAH, these patients do better, not just in terms of spironolactone being a diuretic, but feel that it has an effect on vascular remodeling. So in order to test that, we took a pilot study of investigating the use of spironolactone in terms of a double-blind, placebo-controlled crossover study of spironolactone versus placebo in our well-characterized cohort of PAH patients. And what we see that these patients do well tolerate spironolactone. There were no adverse events. It was safe. It was well tolerated. Although we enrolled patients who had normal background renal function, they had normal background liver functions, and normal sodium, and they had no hyperkalemia. And therefore, we didn't see any of those effects going into the study and at the completion of the study. So that's one thing that we looked at. The second thing, what spironolactone has been shown to do is it decreases the collagen metabolism. So we looked at indices of collagen metabolism as an indirect measure of ongoing vascular remodeling in pulmonary vasculature and in the right ventricle of these patients. And we have recently published a paper showing that these indices are elevated, collagen metabolism indices are elevated in patients with pulmonary hypertension, and there is a relationship between worsening levels of collagen indices in these patients as their disease becomes worse. Looking in that regard, that study is ongoing. We are looking at the effect of spironolactone on collagen metabolism also as a second part.
How important do you feel the role of spironolactone is in PAH patients?
I think it's very important. We use it in our practices. There are many centers that use and utilize spironolactone in their normal clinical practice, although there is no published data to show the efficacy, safety profile of spironolactone in PAH patients, but we use it because it seems to help, as not only as a diuretic, but I would submit that it helps in terms of the disease processes, although I cannot at this point in time tell you how it does it, but we strongly feel that it has an effect on vascular remodeling. And our ongoing study hopefully is going to shed some light on that.
So what direction will you go in next?
So what we're going to do is look at the effects of spironolactone on collagen metabolites. And in this crossover study, we will be able to go further and look at the effect of spironolactone. It's a crossover study, which basically means that every patient is going to get placebo or spironolactone in a random order. And after 8 weeks, it's going to be switched. So first 8 weeks, they're going to get placebo or spironolactone, and in a crossover study, the last 8 weeks, they're going to get either placebo if they got a spironolactone before, and vice versa. So for each patient, we're going to collect biomarker levels at baseline, at the time of the crossover, and at the end of the study. So we will have some indication of what happens to these collagen metabolites, and we will also look at indices in terms of echocardiogram, RV function, the functional capacity, the exercise capacity in terms of the 6-minute walk distance, and other biomarkers such as BNP, etc., to tell us actually if spironolactone does have an effect on these indices.
Thank you. We wish you luck.
Thank you very much.